I'm Dr. Lochemes. Today I'd like to go over a few common ankle problems, the outside of the ankle, the common ankle sprain and some other associated conditions, and the anatomy. This is the ankle and a couple of important structures surrounding injuries that we commonly see. We have the tibia here, the fibula here, and then the talus bone here. When people sprain their ankles frequently, the foot rolls like this, and you literally can see how the skin stretches and the deeper structures stretch or tear as well. You can tear this ligament, the anterior fib-talar ligament, is the most common one to be injured. If the injury is more severe, we will see injury to the fibula-calcaneal ligament as well. Back here in red, I've drawn in the peroneal tendons. These peroneal tendons have the job of everting the foot, and as the foot is internally supinated or internally rotated, there will be stretching of these tendons. There can be tearing of the peroneus tendon, a very common injury and a reason why the typical ankle sprain won't get better. The patient perceives that their ankle is still hurting, but what's happened is these ligaments might have finally healed, but the tendons have not. Up here we have another ligament joining the fibula and tibia here, the tib-fib ligament, the high ankle sprain, or often called the syndesmosis. This ligament, if injured, can result in either serious injury with widening of these bones, or if nothing else, if they're sprained, they can lead to months and months of pain because they don't get better as quickly as this one does. This is more of a 6-week kind of injury. This can be months and months. So getting the injury of the outside of the ankle accurately diagnosed on the front end can limit the downtime or often predict how much invasion into your life or sport your injury is going to have. All right, so we've gone to the other side of the ankle, or the inside, the big toe side, the medial side of the ankle. We have in green here a nerve. It's called the posterior tibial nerve, and it can be compressed right behind the ankle. It can give deep, vague ankle pain and numbness into the bottom of the foot. It's equivalent almost to like the carpal tunnel of the wrist. It can be a tarsal tunnel of the ankle. Thumping on it can cause symptoms into the foot. It's one curious way you can check yours. But there's also another thing that lives right in the same area, which is called the posterior tib tendon. The posterior tib tendon is a tendon that comes up from the muscle belly here, around that bone, and into the navicular. We talked about in one of our other videos about the archless foot or the flat foot and pain along the inside of this bone, pain right here, and or pain swelling along the inside of the ankle right here. The posterior tib tendon frequently becomes inflamed in females over 40 after a minor injury. They'll have pain that just won't get better, and it's pain up in here right behind this bone, and they typically have swelling after standing or walking for long periods of time. It tends to be a thing that just kind of insidious in onset, slow to come on, and then just won't go away. It is also right adjacent to the ligaments of the ankle called the deltoid ligament, which is on the inside of the ankle, right here. And that would be the medial ankle sprain if the foot goes out like this, a much less common injury. And if you're suspicious that that's your problem, I'd have it evaluated because it may indeed be a variety of other things. Right here in the front of the ankle where the tibia and the talus are, you can have a chip of this internal bone. These are ankle sprains where the foot is going either this direction or this direction, and the bone's bumped up right here and chipped or bruised that bone. The pain and swelling will be in the front of the ankle all the way across here, and sometimes you'll feel a click or a pop, but you'll see fluid in the front of the ankle, and it hurts with any motion. That's a more serious version of the ankle sprain, so to speak. It results in a talar OCD or osteochondral lesion, and that requires assessment with an MRI and possibly even surgical intervention.